Hi, my name is Linda Smith, and I am currently a University of Wyoming outreach student seeking my bachelor's degree in nursing. I have been asked to provide a lecture regarding nursing retention, and that's the topic that I'd like to cover today. Some statistics. The U.S. nursing shortage is projected to grow to over 260,000 registered nurses by 2025. Mentoring has been shown to be a great way to strengthen the nursing workforce and in turn improve the quality of care and patient outcomes. Multiple studies have addressed the positive influence a nurse mentoring program has on long-term nursing retention. So what I'd like to show today is what role does a nurse mentoring program play in nursing overall. Some background information for you. The 2013 national average turnover rate for bedside RNs is 13.1%, and that's up from 11.2% in 2012. Student nurses who attend a nurse mentoring program have a support system in place for feedback, share responsibilities of patient care with a trained coworker for a period of time, and are allowed to train with hands-on experience without the ultimate responsibility of patient care. Implementation of a nurse mentoring program provides the means of creating a learning atmosphere for graduate nurses. This program is very near and dear to me. I was fortunate enough to be able to attend a nurse mentoring program myself. After graduation, there happened to be a position open in the emergency room, and that's something that I decided I wanted to try to fill. Therefore, I was able to have a mentor, or we called them a preceptor, same thing, step into place, and I was able to shadow her for 3 months. And I will tell you, in that 3-month period, I learned more hands-on experience than I did in the 2 years of nursing school that I had just attended. She took apart, one evening we were working nights and we didn't have anybody, and she took apart the ER, basically, sent me on a scavenger hunt and said, go find this stuff. Well, I had a little bit of an advantage because I had been a medic in that same facility for 5 years. So I kind of knew what stuff was called, but still going from a medic to having a partner with you all the time to being the sole nurse was very intimidating and a bit scary at times. However, I was able to find all of the information that she wanted, and then the next night we decided we'd take the medicine Pyxis apart, and so we went through and she tested me on all these medicines. I'll be honest, half of them we probably haven't even given yet. That was over 5 years ago. However, by the end of my preceptorship, I knew those medicines, back and forth, sideways, up and down. And it wasn't her responsibility to ensure that I knew what I was doing, but she did everything in her power to help me be a good nurse and develop good skills, and so that I have the benefit of my patients in mind and nothing else. Preceptor-based programs assist in recruiting new nurses and decreasing turnover rate. Insufficient nurse staffing and high workloads are leading to higher patient mortality rates within the hospital setting. So in other words, we're running out of nurses, and the nurses that we do have working have a really high workload. Therefore, they're not able to spend the adequate enough time with each of their patients, and it's increasing mortality rates. And that's not something that we really want to do. As a nurse, it's my responsibility to take care of that patient. And I don't care if I have 20 patients or I have 1. I personally would like to give the same care to each and every one of them. But when you have that many patients, especially patients that require more time and attention, sometimes you can't do that, and you just don't have enough staffing. So it is recommended all student nurses and graduate nurses should have an opportunity to attend a nurse mentoring program. By instituting these practices, facilities would increase nursing retention, therefore decrease nursing turnover rate, improve patient outcomes through adequate staffing, improve overall quality of care with competent trained nurses, and help decrease the national nursing shortage. It's a win-win situation. I would like to open the table up for any questions. If not, thank you for your time.